Thank you, Francis, for joining us on Talking Allergies. To begin with, tell us a little bit about who you are and about your background as well.
Yeah, no, thank you for having me. My name's Francis. I'm a dermatologist from Melbourne. I work in public practice in Monash Health and also at the Skin Health Institute, which is a tertiary organisation for dermatological care. I also work privately for Virtual Dermatology, which provides services for patients across Australia to access dermatologists within 2 weeks. And I also work privately at Brighton and Williamstown Dermatology. I've trained through most of the tertiary hospitals in Melbourne and also was fortunate enough to do a fellowship at St John's in London. My special areas of interest include contact dermatitis, biologics, and clinical trials.
Thank you for that introduction. Now, Francis, you've worked across a range of in skin and allergies. How have you seen the impact of allergies on the skin with what you've worked across?
Yeah, the impacts are huge and really immense and can come in many forms. I think, firstly, allergies can affect skin from what we term as type 1 hypersensitivity, and this is immediate reactions, meaning you eat a peanut or you eat mango and straight away your eczema flares up within hours, and this mainly happens in babies and kids with eczema. The other type of situation where you can get allergies impacting on skin is what we term as type 4 delayed hypersensitivity. And this is where we have a condition called allergic contact dermatitis, where you may use a lip balm or moisturizer or sunscreen, hair dye, and it may even feel quite nice to begin with, but then you develop a delayed allergic reaction where 2 to 5 days later, your eczema feels like it's on fire and it's really burning and really having a huge impact. And I think we see that, in babies and kids, it has a big impact on not only the child, but also on their sleep, on their growth, on parents. And then in adults with delayed hypersensitivity, it has a huge impact because often there's a very long delay in terms of diagnosis. Often it's just put down to as, you've got eczema and you've just got to manage it without anyone sort of realizing that there's an allergic component to it. And they go for years suffering and not getting the right diagnosis. And with allergic contact dermatitis in adults, it's often affecting very visible parts of our body, like the face or the hands, places that we contact a lot. And it has a huge issue in terms of their quality of life and work and other aspects of life.
With all those different groups of people you've spoken about, so when should someone see a dermatologist?
Yeah, really good question. I think someone with allergies should really see a dermatologist ASAP. And as we know, there is a difficulty in accessing dermatology care sometimes in terms of the wait times. But really, the earlier you get in, the better we can diagnose and investigate and hopefully provide a treatment plan. Just to give an example, in babies and kids with allergic reactions, we can always refer them to the right services. We can consideration of skin prick testing with allergists, or we could do preliminary blood tests looking at immediate hypersensitivity. Whilst in adults with allergic contact dermatitis, that delayed hypersensitivity, the earlier they get in, the better, because we know that people who are allergic to one thing have a much higher risk of becoming sensitized to more things. And once you are allergic to something, you are forever allergic. So the sooner we can get on top of it, the better. And then we can give you sort of ways of avoiding and hopefully finding products that are suited for you.
Of course. And you talked about the wait times just before. Are there some ways that people can look at trying to sort of get around those wait times or have faster approaches to receiving that care? Could they go to their general practitioner or go directly to the dermatologist themselves?
Yeah, absolutely. I think, that's one of the 2 initiatives I guess I'm involved in that's trying to improve access. One is virtual dermatology, where we're providing teledermatology to patients across Australia with a wait time of less than 2 weeks. So we're hoping to try to break that difficulty in terms of getting in to see a dermatologist. And I guess something that we'll discuss a little bit later on, the CosMe App is a very accessible app that's available on the App Store. Yep. It's free currently, and hopefully it can allow patients to figure out what their potential allergens are and to empower them to find the right products and to avoid the potential allergens.
Great. Now, you work across a few different organisations, one of them being the Skin Health Institute. What sort of services do they provide people with allergies?
The Skin Health Institute is really one of the leading centres for both research, teaching, education, and clinical trials, as well as providing excellent clinical care. And they have a tertiary contact dermatitis as well as occupational dermatitis clinic, where they essentially try to find out what are the potential allergens that are causing people to get rashes from things that they're coming into contact with or in their occupation and their line of work. They undertake patch testing, and they are Australia's leading organisation in patch testing, where they actually send out the patch test kits to the dermatologists across Australia who do patch testing in their private practice as well.
Now, Francis, you have developed an app in collaboration with the Skin Health Institute that helps people with skin-related allergies and navigating sort of the products to look for and so forth. What is the app called, and tell us a little bit about it and who it's for?
The app is called the CosMe App, and it's an app really designed for patients who do have or suspected to have allergic contact dermatitis. As you I'm sure are aware, every time you read an ingredient label on any product, it's a whole bunch of chemical mumbo jumbo names, and it's really hard for the general person to know what is potentially an allergen. And the app really just provides a good traffic light system to show you what are the potential allergens and which ones to avoid. It also provides personalized recommendations based on your known or suspected allergens, and you can easily filter for products based on sort of categories and ingredients that you want to find. It's also a tool for clinicians and also a tool for the general consumer, because as I mentioned before, we know that yes, treatment is really important, but prevention is equally, if not more important, because if we can prevent people from developing contact allergies and they can just start off by using products that don't have many allergens, that would be ideal, because once you are allergic and sensitized, unfortunately, generally it's a chronic long-term allergy that you just have to avoid.
What got you to sort of work on creating this app for people with skin-related allergies?
Yeah, look, I think this is really just from my day-to-day work. I think as a dermatologist, I see every day the struggles that patients have in terms of finding the right investigation and treatment. These are 1 in 5 people do get contact dermatitis, and unfortunately it's super common. You react to your hair dye, to your sunscreen, to your makeup, to hand sanitizers, and people really struggle with this and really struggle to find a solution, and they often going for years, going through various healthcare practitioners, trying many, many different creams, or spending thousands of dollars trying to solve their own problem. And I guess that's really what's inspired me to realize that it's so difficult to get to the right diagnosis and the right management. And hopefully the app allows patients to feel empowered to find the right product and to thereby hopefully solve or prevent their allergic contact dermatitis.
So if you had to explain an easy workflow for someone who wanted to use the app for their contact dermatitis, how would you go into the app and use it?
Yeah, so when you sign up to the app, it will ask you whether you've had patch testing or not. And if you have, you can plug in the known allergens that you are allergic to. If you haven't, that's okay as well. And then when you search for products, it will come up with sort of labels saying this product is safe for you based on your known or suspected allergen profile. And you can also explore the app just based on products that you have on your shelf as well. So if you've got, various makeup products and sunscreens and moisturizers, you can plug in those products and see how many red, highly allergenic allergens it has, or yellow, moderately allergenic products, ingredients. And then you can also filter. So if you want to find a safe product for your baby, a moisturizer, you can choose a category and then filter to avoid certain allergens. So that is also possible too.
Wonderful. And how can the clinicians out there as well across Australia use it for their patients?
Yeah, absolutely. So I think this is really the aim as well, in that we want to help clinicians streamline their care for patients. So for dermatologists, we often spend an hour after patch testing trying to figure out what products a patient can and can't use. And it is very time consuming. And if we can improve our efficiency and clinic throughput, and we can thereby reduce the wait list and improve access. I've also spoken to many general practitioners and pharmacists who've been very excited to hear about the app, because as a pharmacist, they often get people come into the pharmacy and say, look, I've reacted to this cream, what other cream can I use? And often it is really difficult, even for healthcare practitioners, to know what products they can and can't recommend. So hopefully it's a tool not only for the dermatologist, but for allergists, immunologists, general practitioners, pharmacists, all to be able to use and recommend the right products to our patients.
Fantastic. And where can people find out about the CosMe app to download it and learn more?
Yep, so you can download it on all the app stores from Apple and also the Google Play Store. It's free for use at the moment, and it's also available on Allergy Life as well. And any feedback is obviously welcome. It's a brand new app, and it's made by volunteers with myself and Skin Health Institute, so we're very happy to take on board any feedback. You can also request new product recommendations within the app if it doesn't have the products that you currently have.
Thank you so much, Francis, for sharing all that information about dermatology, contact dermatitis, and the CosMe app as well. If someone is joining in and listening in and they have just discovered they've got skin-related allergies, a way to get started on that journey of diagnosis and treatment?
Yeah, look, I think apart from downloading the app and trying to see what allergens are within your products, one of the other, more practical ways is also what's known as repeated open application testing. So if you are suspecting you're allergic to a particular product that you have, you can apply that to somewhere that's quite sensitive, like the inner upper arm, every day for 5 to 7 days. And if you do develop an itchy allergic reaction, then that can be a telltale sign that you do have allergic contact dermatitis. And then obviously getting in to see a dermatologist and consideration of patch testing as soon as possible is best.
Wonderful. Thank you so much for all that information, Francis. We've really appreciated having you on Talking Allergies. Before we finish off, is there anything else you'd like to say or share with the allergy community in Australia?
No, just thank you so much for having me on here, and I hope that's been of use. And I think really just more awareness needs to be brought about for allergic contact dermatitis. It's often under-recognised and under-diagnosed. And as I mentioned, I have patients who struggle for years being told they just have endogenous eczema when they in fact do have an allergic component as well.
Great. Well, thank you very much, Francis. Appreciate having you on.
Thank you, 𝘠𝘠𝘭𝘬𝘪𝘦𝘭𝘭𝘦.